delighted to have you with us for our IRPA seminar series. This is the last one of the semester, so stay tuned for next fall. We'll have another great series with wonderful speakers. Today we are excited to have the member who's right here at UW, Associate Professor of Sociology, Clarko, and we're especially excited because she's going to be doing a talk based on her new upcoming, coming out in June book, which I hope she tells you how to find or purchase or download. Hopefully not pirated copies. So I'm going to turn it over to her. She's asked for clarifying questions along the way, but please hold the hard-hitting substantive discussion until the end. We're thrilled to have you here. Please take it up.
Yeah, thank you so much for having me, Catherine, and thank you all for being here, especially at this time of the semester and in the midst of so many things going on right now. It's an honor to be here with you all and to have a chance to do this work. I haven't had a chance to meet many of you yet. I just started here at Wisconsin in January 2023, so just a little bit over a year for me here, and I'm looking forward to getting to know you all. I was at Indiana for 10 years before this, so that's where some of the research that I'll talk about today was conducted. And to that end, before I get too far into things, I do want to take a minute to thank the amazing team of researchers and collaborators that helped with the work that went into this book that I'll be sharing. I'll talk a little bit more about why this team was so big in a minute, but certainly let me take a minute to acknowledge the funding that went into this and the folks who helped with collecting data along the way. So before I get into more of the nuts and bolts, I want to start off with a story of a mom who I will call Brooke. So Brooke, growing up at home was not a particularly happy person. She was raised in a conservative, white, evangelical, Christian kind of working class family. And her parents had a fairly volatile relationship growing up. And because of that, given her upbringing, Brooke decided fairly early on in life that she never wanted to have kids of her own. She wasn't interested in being a parent until she ended up getting accidentally pregnant in college. So at the time, she and her boyfriend, Brendan, who I call Brendan, were initially planning to get an abortion. His parents had even offered to pay for it. They were planning to go through with this until Brooke talked to her own mom about this, who ended up persuading her to go and get an ultrasound and ultimately to keep the baby. And her mom sort of promised, look, I'll help you take care of the baby. You can stay in college. You can finish out school. But what ended up happening, though, was that once her son Carter was born, Brooke's parents really sort of never followed through or weren't actually in a position to be able to follow through in providing the level of support that she would have needed, in particular to stay in college. So they were both working full-time in relatively low-wage jobs and couldn't afford childcare between them. And so, going to school during the day wasn't an option because she couldn't afford childcare. And she didn't trust her parents to watch her son. So going to school, night classes also weren't an option for Brooke in that moment too. And so without childcare, it was tremendously difficult for Brooke to keep up with her schoolwork. And she ultimately ended up dropping out of college and even moving out of her parents' house and into a women's shelter with her son. Since being on her own would make it easier to qualify for subsidized housing and for kind of other types of support that she needed to be able to take care of her son on her own. Ended up signing herself up for welfare, for WIC, for food stamps, ultimately for childcare subsidies when she was able to find a job as well. Along those lines, and since welfare has work requirements attached to it, Brooke ended up kind of taking the first job that she could find, which was a kind of part-time, low-wage retail job, actually working at the same store as her mom. And she talked about how much she hated this job. She's like, I hate retail. I don't like working in this environment. This is not good for me. And she was actually complaining about the stress of this job to the childcare provider, to the woman who ran the childcare center where her son Carter went. And the childcare center director was like, oh, okay, well, come work for me. We have an opening, we could use some more childcare providers. And she's like, she wasn't sure about it at first. She was kind of hesitant about working in childcare, whether this would be the right fit for her, especially given that she'd never really wanted to be a mom in the first place, but ended up kind of loving, but didn't love the paycheck that came with it. I mean, this was a minimum wage job with no benefits except for free childcare. And that was what made it worthwhile, was the sense that this was, the best job that she could get that was full-time, that came with free childcare, which at the time was costing her roughly as much as rent. And so for her, this was, a good option, but it still wasn't, a highly stable job financially. Even when she got promoted to assistant director a few years later, she was still only making $25,000 a year. That was, as the sort of second in command of this child care center. And so given the precarity of this situation, Brooke was interested in going back to college. She thought about, I want to go back to school and become a nurse because this seems like a possible path to financial stability, but she couldn't figure out how to make childcare work. She still didn't have anyone that she trusted to watch her son at night, and she still needed a job during the day. And so ultimately, 5 years later, when I first met Brooke in 2019, she was still working at the childcare center. And at that point, by that point, she had met and married her husband, Robbie, who's an auto mechanic, and they'd had a second child together, her daughter, Emma. But Brooke still really she'd kind of enrolled in college a couple of times, but hadn't really made any progress toward getting her degree. And in fact, Brooke's new in-laws were pressuring her to kind of abandon her college plans and even abandon working full time. They wanted her to stay at home and be a stay-at-home mom to their new granddaughter, essentially, was the pressure that she was getting on that front instead, despite the fact that her husband was only making about $25,000 a year as an auto mechanic. And so this was not, it was sort of a complicated situation for Brooke in terms of the pressure she was facing on all sides. So what do we take away from Brooke's story? I think, as I argue in the book, Brooke's story illustrates how even before the Dobbs decision, the US was already taking steps to trap women in motherhood. And it also shows how kind of trapping women in motherhood by making it difficult for them to make other choices. And then kind of once they're in that situation, limiting the kinds of choices that are available to them, it makes it easier for what I talk about in the book as sort of the engineers and profiteers of our DIY society, kind of the big businesses and billionaires who are profiting from, and also the politicians who go along with it to profit in the process as well, how they exploit the unpaid and underpaid labor of women to help maintain this kind of, to help maintain both our lack of a social safety net and the success of our economy without it. And essentially that we're maintaining this illusion of what I talk about as a DIY society. And I'll explain what I mean here in a minute, but let me kind of back up and tell you a bit about the data where this comes from. So the bulk of the data in the book come from more than 400 hours of in-depth interviews that my research team and I conducted with families from across the socioeconomic and racial and political spectrum between 2019 and 2022. Most of those families we initially recruited through prenatal clinics in Indiana, and so a lot of the team members helped with in-clinic recruiting and kind of getting people into the study at the time. And at the time, I kind of envisioned this as a study of the best laid plans of parenting, in the sense that where do your ideas about who you want to be as a parent come from, and how are those shaped by the people around you, and then what happens when life intervenes and you can't actually parent the way that you want to. And so that's what I thought I was going to be studying. So we started by recruiting 250 pregnant people. All of them identify as women, so I talk about them as women here. From prenatal clinics, and then following up with them at 6 months and 12 months and 18 months postpartum with additional surveys and in-depth interviews about their experiences. So the data collection for this hit in the middle, was ongoing when the pandemic hit in 2020. And so in the wake of that, we ended up doing 3 more waves of pandemic-focused data collection with the moms, with their partners, and with some of their social network contacts. All of the original 250, about half, it was their first pregnancy, and half they had older kids as well. And we wanted to, especially during the pandemic, add some parents of school-aged kids, even if they didn't have little ones. So we did some kind of additional data collection there too. So these kinds of pandemic interviews were really where this book comes from, particularly seeing the kinds of challenges that families were facing in the context of, COVID school closures, COVID health-related problems, and how the burden of those situations and crises really disproportionately fell to women within the families that we were studying. In addition, though, because this was mostly an Indiana-based sample, I also wanted to see how these patterns were playing out nationally. And so I also conducted 2 national surveys of US parents with kids under 18, one in late 2020 and one in late 2021, each with about 2,000 parents to better understand kind of what was going on in the US as a whole. And then the book also draws on some other sources, some historical case studies, some documents, some sort of media analyses, and certainly lots of evidence from other prior research as well. The broad overview here, the core argument here is that the engineers and the profiteers of our sort of DIY society or DIY economy really use women's unpaid and underpaid labor to maintain the illusion of this DIY society and to persuade us that we can get by without a social safety net, without the kinds of protections that people in many other high-income countries often take for granted. So when I'm talking about a DIY society, I'm really talking about kind of neoliberalism in the sense of the idea that people are supposed to support themselves without assistance from the government, and certainly without, and kind of are responsible for their own success in the process too. So as historians Naomi Oreskes and Eric Conway talk about in their book, The Big Myth, this neoliberal model was developed by a set of Austrian economists in the 1930s who were, and at the time, a number of kind of US business leaders were looking for ways to push back against the higher corporate taxes, the higher taxes in general that were being put in place to pay for New Deal policies. And so they, one of the things that they did, the National Association of Manufacturers, was to pay to recruit these Austrian economists and install them in high-level positions at universities in the US, where they then went on to train the next generation of economists who kind of followed suit. And this included folks like Milton Friedman, were among the first people that they trained once they got here. And so in addition to that, and the result of this was to create essentially what political scientist Jacob Hacker calls the Great Risk Shift. Kind of putting in place these kinds of policies that involve sort of massive reductions in corporate tax rates, personal tax rates, deregulation of corporations, cuts to social welfare spending, a growing emphasis on corporate profits. These are all things that we kind of associate with this great risk shift. To justify this great risk shift, the sort of neoliberal economists and policymakers who were associated with this sort of movement or this push toward the great risk shift also developed propaganda campaigns, things like General Electric Theater, which was originally hosted by Ronald Reagan, to try to convince Americans that they should buy into this DIY illusion, persuading them that we don't actually need, a strong government safety net, and that in fact we'd be worse off if we had one, because their argument was that we would make better choices, we would protect ourselves from risk better if we didn't have those kinds of protections in place. So of course, the evidence suggests that a DIY society not having a net doesn't actually make us safer. At the same time, though, and as I talk about in the book, essentially in the wake of these changes and in the wake of these kinds of propaganda campaigns, families and communities in the US have been forced to figure out how to weather this great risk shift. And one of the ways that they've done so is by taking the extra risk that they've been handed and by dumping it onto the most vulnerable members of their families or their communities, which often means women, and particularly women from racially marginalized groups, women from socioeconomically marginalized groups end up doing this work either for their families or filling in gaps for other families as well. So along those lines, take, for example, the story of a woman that I'll call Akari, who's a single mom of two who is biracial Japanese and white. Akari and her boyfriend Theo met in college, but they both dropped out because of the high costs, because they couldn't afford to keep paying tuition. And Theo, who's white, started his own home maintenance business, which was bringing in about $30,000 a year. And so at the time, Akari was working part-time in retail and also helping Theo with the business. And things were fairly stable financially for them until their oldest daughter, May, was born in 2015. At the time, they didn't have any family or friends nearby who could provide full-time childcare, but they also made too much to qualify for any sort of government subsidies, any sort of childcare vouchers, for example. But at the same time, certainly not enough to pay for the full-time cost of care, which for an infant could have easily been $1,500 or $2,000 a month at the time in the community where they were living. So Akari ended up becoming, like many moms in similar situations, a stay-at-home mom, and a pretty typical one at that, in the sense that the data suggests that about 75% of American stay-at-home moms today are in households with incomes of less than $50,000 a year. This isn't what we think of typically when we think of a sort of stereotypical stay-at-home mom, but this is much more the reality, is women like Akari. And she was still a stay-at-home mom when I first met her in 2019, when she was pregnant with her second child, Ren. And that arrangement, she didn't love being a stay-at-home mom. She loved her kids, enjoyed the time with them, but she wished her family was more stable financially, but couldn't figure out a way to make it work. And things got, unfortunately, even more complicated in the summer of 2020 when Akari's fiance, then previously boyfriend, then fiance Theo, died suddenly, unexpectedly. And the first couple of months, oh gosh, the interview that I did with her right after this happened was like it wrecked me for days. Anyway, it's still hard to talk about. So essentially, these first couple of months for Akari after Theo died were just sort of this blur of grief and government forms, in the sense of trying to navigate kind of all of the politics of death, help her kids through this, help herself through this. But at the same time, like most US adults, he didn't have any life insurance, and they didn't have any savings, and she didn't have a job. And so this kind of meant, so like Brooke, who we talked about before, she ended up moving herself into a shelter with the kids to be able to qualify for public housing. ended up on welfare, ended up on food stamps, kind of trying to navigate all of this. And this was really hard for Akari emotionally. She'd grown up in a sort of middle-class suburban family. Her parents had split up when she was in high school, and her mom had moved back to Japan, and she wasn't really in touch with her dad anymore. And so things were very different for her financially than they had been growing up. She talked about how she never knew anybody on welfare. And she even talked about it. She said, like, she felt guilty about relying on what she called other people's tax money, which is actually, ironically, a Milton Friedman quote. And so at the same time, the amount of money that she could get from welfare wasn't enough to feel any sort of guilt about. In Indiana, the max she could qualify for with 2 kids was $288 a month. And even with extra support in the form of things like Medicaid, food stamps, subsidized housing, et cetera, she rarely ever had enough to be able to make ends meet. Paying for car insurance, for example, became sort of insurmountable. But she was living in a community where, her only option public transit-wise was a bus system, which was not a particularly reliable one at that. And so she had to figure out a way to keep paying for her car, despite the meager benefits that she was earning, and then was also facing pressure to try to find a job. But again, this is the fall of 2020. At this point, where there are no jobs. And so by the time she was able to find one, it was kind of late in the year, kind of around the Christmas season of 2020, with the sort of some businesses starting to reopen. And the first job she got was a part-time job in retail paying less than $10 an hour. And because it paid so little, she ended up adding a second job in 2021. But even that didn't help all that much, because even between the 2 jobs, she was rarely getting more than about 25 or 30 hours a week, which just wasn't enough to cover her needs. And at the same time, because of limited childcare options, she couldn't take, there weren't many things that were open to her. Her Head Start program ran from 8 to 3. She could pay for extended hours, but even that was only until 6. So there just weren't that many options she could take. Ultimately, Akari ended up adding a third part-time job, working the weekend shift at a manufacturing facility a couple of towns away. And she could rely on Theo's sister to watch the kids on the weekend. She worked during the week, but she was home on the weekends. And so what Akari does is drops her kids off on Friday night and then actually goes home and sleeps. But she figures that's the easiest way, because she has to get up so early in the morning to drive to the plant where she works, that it doesn't make sense for her to kind of do the back and forth and disrupt the kids' schedules, that it's easier to just not see them at all over the weekend until Monday morning when she picks them up for school. And she talked about, she said this is like deeply devastating for both her and for her kids, who she basically never gets to see. She said, my daughter has PTSD because of her father's death. She went from having a dad who works and being a daddy's girl and having a stay-at-home mom who always cared for her. And now there's no dad, and mom's dead. So in her mind, she lost both parents. And at the same time, the sacrifice wasn't leaving Akari all that much better off financially, because with that third job, it sort of pushed her over the benefits cliff, in the sense that she no longer qualified for any welfare services, no longer qualified for subsidies when it came to housing and when it came to childcare. So now she has to figure out how to kind of manage all these extra costs on her own. And she talked about how she'd actually be better off financially going back on welfare, but that she ultimately calculated that because of time limits on welfare and because of restrictions on being able to keep any money saved, that really, she talked about how welfare is not going to last forever, and I'm just going to get older. Right now I can work, but what am I going to do when I'm 60? I can't have anything saved up on welfare, and you can't move up. You have to stay within that line. And right now where I'm at, I lost all my welfare services, but if I continue to work, eventually maybe I can get a raise. And that's kind of, the hope that she's holding out, at least for the future. So essentially what we see from Akari's story is that this great risk shift has really trapped families in a sort of constant state of precarity. And when we can see that precarity in the fact that compared to people in other high-income countries are more likely to be depressed, more likely to get sick, more likely to die at young. We can see it in the fact that we often work longer hours but produce less, that we tend to have higher poverty rates and lower economic growth rates, at least during some periods, and that we often experience higher levels of political unrest. So essentially, and faced with all this financial precarity and economic and kind of social precarity, we might expect American society to crumble. That it's sort of a question of how are we figuring out a way to survive this. But as we saw in Akari's story, and certainly in Brooke's too, American families and communities have been able to weather this great shift by essentially taking that risk that's been handed to families and communities and pushing it onto women to manage in many cases, not exclusively, but in many cases instead. And essentially, once they're in that position, women have to then either figure out how to carry that risk for themselves or how to outsource it if they're lucky enough or privileged enough to be able to do so, oftentimes by dumping it onto other women who are in even less or even more vulnerable positions than their own. So to that end, this system of exploitation is particularly damaging for women from lower income and middle income families, and disproportionately for Black and Latina women and for women from other racially marginalized groups. These women can be easily pressured into having more children than they planned, or not, or kind of having children at timing that it doesn't work for them because of the vulnerability of their circumstances and the limited options that they have their access to healthcare wise and in many other circumstances. And at the same time, they can also be, and once they're sort of caught, once women in these precarious positions are caught in motherhood, that also makes it very easy to limit the kinds of choices that they have open to them in terms of jobs, in terms of support from their families and their communities. And essentially this is because in the absence of strong protections, in the absence of things like universal childcare and universal paid family leave, motherhood is, I mean, certainly it's not the only route into precarity, but it's a particularly effective route into exploitation, particularly for those who can't afford to outsource childcare or other types of help with care. Because essentially, and as I'll talk about in a minute, it means that motherhood, you know, when we especially task this as women's responsibility of caring for children, it would leave women, especially those with limited resources, with nowhere to turn for support and with nowhere to hide when other people in their families and communities ask them to try to hold even more. So to tell you what I mean here, I'll talk about a mom who I'll call Patricia. Before the pandemic, Patricia, who's Black, was still married to her husband, Rodney, and they had 3 kids. They had one who was a toddler and then 2 kids in elementary school. And at that point, Patricia was working full-time as a customer service rep for a health insurance company, working full-time from home even before COVID. And her husband, Rodney, was working full-time as a construction laborer. And together they were making a little less than $30,000 a year. Now, Patricia, who unlike Rodney has some college education, she might have been able to find a higher paying job, but she ultimately took this job because it was the best job that would allow her to work remotely in a sort of pre-pandemic world. At the same time, she talked about this as a job that she found demoralizing and demeaning, that she really wasn't doing. This was not a happy place kind of a job for her. But being able to work remotely meant she could be home for her kids after school. She didn't have to pay for after school care. It meant that she could be home if there was a snow day, if she needed, if there were sort of gaps in the childcare system that she needed to fill in, and saw this as her responsibility to fill. Particularly with Rodney as not having any college education, kind of had more limited options job-wise. At the same time, and so she was kind of in this default parent role already before the pandemic hit. And unfortunately, like many couples, because of that status, that also meant that they didn't even talk about who was going to care for their kids when schools closed, when childcare centers closed. This was an incredibly common story, that it was just expected that mom would be the one to pick up the slack in those moments. And that was certainly the case for Patricia. At the same time, having to do her full-time job remotely while also caring for the kids full-time was deeply difficult for Patricia. She talked about how the kids were kind of constantly interrupting, and it was leaving her kind of constantly frustrated and overwhelmed. She said, you start getting a headache and you want to sit and listen to them and talk and everything, but it's just like, please go, everybody just leave me alone. And so she was sort of grappling with the sort of guilt around this. And she talked about how she's like, I don't like being so short with my kids. She said, I have to work on that more. When it's time to clock out, I need to not clock out mentally as a mother too. So she was sort of feeling pressure on both sides, feeling pressure to both, focus more on her work and then also commit more to her kids when they were at home. And so in the wake of that sort of sense of failure during the pandemic, Patricia ended up deciding in the fall of 2020 to cut back to working for pay just 4 days a week instead of 5. And she made that decision. She wanted to have more time for herself, more time for her kids. And also she had recently found out that she was pregnant with twins. And so she was just physically exhausted at this point and really needed a break. What ended up happening though, was that Patricia's family saw that extra kind of extended family, saw that extra day off every week as an opening to ask Patricia for more help. She was one of the only people in her extended family who had a reliable vehicle. And her and most of her extended family live in the Indianapolis area, which was rated in 2019 as the worst city in the country for public transit. And so really and so they were asking her, can you drive me to the doctor? Can you drive me to the grocery store? Can you use that Friday off to help me out? And she felt guilty saying no, in part because of the health risks that came with taking the bus in the context of high levels of COVID infections. And also because she knew that, she was their best option. And also worried about how if she said no to them in the moment, she might also need help in the future from them, and might be in a position and saying no now might put her own support at risk in the future as well. And unfortunately, that worry about needing that support in the future ended up coming to pass. In the summer of 2021, Patricia and Rodney split up. They'd split up a couple of times before, but this seemed pretty permanent, at least at the time. And she talked about how this was, a frustrating thing, but that this was sort of the right decision for her at the moment, even though it meant that she and her now 5 kids, because this was right after the twins were born, that she and her now 5 kids would have to move into a smaller place with just 2 bedrooms. And at the same time, she's like barely affording rent on her own, but she's also giving money to Rodney because he was struggling to pay his car insurance payment to be able to come and see the kids, because they now needed 2 vehicles instead of just 1 to be able to get places. And so this was extremely difficult. She talks about how I'm just paying that for him to the point where it makes my finances get backed up a little bit, but I have to do it anyway. And so it's this sense of kind of being stretched in all directions and having to kind of put herself out there for everyone. And so because of this, she ended up, because finances were so tight, she ended up having to even go without any childcare for the twins for a couple of months before a spot opened up at the center where her older kids were going. And so she couldn't afford to pay for any additional help with care. So she's home with 2 twins, trying to work from home. Also, her kids had gone back to her other kids had gone back to school by that point, but it was just a really time. And at that point, she was grateful that she hadn't pushed other people away before, because, for example, she needed her friends to drive her around after her C-section with the twins because she couldn't drive herself. And she needed people to help watch her older kids while she went to the doctors with the younger kids, for example. And so this was, a time when she felt grateful that she hadn't pushed people away in her network before, even when that had taken a toll in her in the process. But at the same time, that support she was getting from her community wasn't necessarily enough to keep the difficult moments at bay. She talked about how it's pretty depressing to have 2 brand new babies and you're doing all this by yourself because you and your partner couldn't get along. And it's not like he's in jail, but it's not like he's actually trying to be part of the kids' lives anyway. And it's just all on you. So as we see in Patricia's story, our attempts to kind of be this DIY society have really decimated families and communities, and particularly put too much risk on low-income communities, especially low-income communities of color in the US. In those contexts, it's often extremely difficult for women like Patricia to get the support they need, and also to find a place to hide with other people around them, because everyone is struggling and needs as much support as possible, and there often isn't enough to go around. And so people like Patricia can be easily conscripted into helping others, even when what they really need is more support themselves. So at the same time, and in this kind of a system, people who are more privileged, and even women who are more privileged, have more options, and in some cases have it somewhat easier, in part because they can afford to outsource some of the risk and responsibility that has been handed to them by dumping it essentially onto others who are in more vulnerable positions. Put differently, it means that the more labor that women are able to outsource, the more they are able to compete with men in the workforce, for example. And even the more they're able to negotiate with their partners for more assistance at home, in part because they have kind of more equal bargaining power, their economic power, income-wise. Along those lines, let me tell you about Holly and Kathleen. So Holly, they're a white same-sex married couple. When their daughter Willow was born in 2019, they had initially planned to split everything equally. They planned to both work for pay full-time, find full-time childcare, split the housework. They'd already had a fairly egalitarian relationship pre-kids, and they were kind of hoping to continue that after kids as well. What happened, though, was that the first spot they could find for childcare was when their daughter was 9 months old. They started looking as soon as they got pregnant. That was the first spot that was available, and it was only going to be a part-time spot. And so they signed up for it anyway and decided, how are we going to figure this out in the meantime? What they decided was that Holly would work for pay part-time because she would do her job remotely. She works as a data analyst, where Kathleen, who works in law enforcement, was going to continue working outside the home full-time. And so this worked fairly well for the first 3 months while their daughter was sleeping most of the time. But after that, it became kind of quickly untenable. And Holly ended up sort of just ratcheting back her paid work hours to the point where she was only working 2 to 3 hours a day for pay, because that was all she could manage given the kinds of childcare responsibilities that she had. And she was sort of desperate for her childcare center, for that spot to open up in childcare, though almost as soon as their daughter Willa actually started childcare. This was 2019, so the pandemic shut it down just a couple of months after that. And so they essentially reverted right back to where they were before, with Holly being the one who is disproportionately responsible for childcare and Kathleen still working outside the home. Now, they were kind of hopeful that the center kept kind of promising that they would reopen. And so Holly asked her boss and said, like, okay, I think this is the date when things are going to reopen. Can I move into a full-time position? Because the center said, okay, we should have a full-time spot available for Willa kind of starting in the fall. At the same time, once they did reopen, Holly found out sort of last minute that they were only going to be open from 9 to 4 every day because they couldn't find enough staff to open for longer hours. They were sort of, like many centers across the country, are facing a serious shortage of childcare workers. And so Holly was deeply frustrated with this decision because it meant that she still couldn't go back to full-time work the way that she wanted to, and frustrated that she was also seeing what she perceived as a decline in the quality of care that went along with COVID too, in part because many of the full-time staffers had left during the pandemic and were replaced with people who had less experience with childcare. When she went to the center to complain, though, what Holly learned was that the center couldn't afford to keep the teachers that they had employed for many years because they were paying them so little, next to nothing, and didn't offer paid family leave, didn't offer paid health insurance, didn't offer any paid sick time even. And so many of those workers had left. And so she talked about how she had this kind of sudden and overwhelming sense of guilt that came with learning, for example, that one of Willa's former teachers had surgery 2 years before the pandemic and was still paying it off, still paying off the medical debt, and ended up having to take a second job during the pandemic, and then just made that her full-time job once the pay was higher than it was in childcare. And she talked about the guilt that came along with this. She said, Kathleen and I just feel really guilty about being complicit in this thing where it's like we have all these women of color watching our kids and we're not really taking good care of them. At the same time, Holly also talked about how, despite that guilt, she felt like there wasn't really anything she could do. She talked about how, there was a certain precarity to her own situation, that she'd had to fight to get that full-time position back from her boss. And she also wanted to make sure they had money to do the IVF that they needed to have a second child that they wanted to have as well. She said, we have more than we need right now, but also it could change at any moment when there's not that social safety net. So you're like, I guess I should just hoard it in a giant pile and sleep on top. So as we hear in Holly's story, even women in relatively higher income families are often struggling to manage the consequences that have come with the great risk shift. They're able to do so better than many other women, in part because they can outsource help with care, but they're still drowning in many cases with the risk that they've been handed, because we've all been left with more responsibility and more risk than we can manage on our own. And because, as we'll see in our next story, what's left over often falls to women, and in part because of the caregiving responsibilities, default status, as we heard before, but also even when men could do more to fill in the gaps. And take, for example, a woman who I'll call Virginia, who's a white tenure-track professor at a research university. She makes about $75,000 a year, and her husband, Charles, is a middle school math teacher. He has a master's degree and makes about $45,000 a year. So she's the clear breadwinner. But like research tells us, even in those kinds of women breadwinner families, she's also still the default parent for both of their 2 kids. In January 2022, for example, when COVID shut down their childcare center repeatedly over the 2-month period, she was the one who ended up sort of shifting her work schedule to care for her son at home because she could do her job remotely in a way that her husband couldn't, and they figured it was safer to save his paid sick days in case he got sick, as opposed to having him take time off in those moments instead. And so he could have done more, but they decided that it didn't make sense to. And so she talked about kind of the frustration that came along with this, but also feeling like she was sort of powerless to change it. Meanwhile, and as part of the sandwich generation, Virginia also found herself kind of taking care of her aging parents in the process, particularly during the pandemic, and particularly after her mom was diagnosed with Alzheimer's, and where it progressed to the point where she could no longer handle some of the basic things that she had always handled for the family, the cooking, the cleaning, the sketching, all of those things. Virginia talked about how her dad and her brother probably could have done more to help in those kinds of situations, but she talked about how it kind of just fell to her. And she talked about an interaction that she'd had with her brother at a recent family gathering that she initially kind of saw as sweet, but that, reflecting back on it in hindsight, it kind of left her with a sour feeling. She talked about how her brother had kind of given her a big hug and told her, "I'm really sorry this had to happen, but you're the matriarch now, and it's all on you." And so it was just sort of, and so in the moment she felt like, oh, that's really sweet. And then afterwards she's like, oh, but he could be doing more too. And so all that responsibility made it incredibly difficult for Virginia to feel as though she could so that she could never even concentrate enough to make progress on things like her research. She said, I do actually have a brain and I love thinking. I would love to be able to do that again sometime. And so at the same time, she also kind of balked at the suggestion. She kind of saw all these emails coming from her employer at the time, kind of encouraging her to take a little time for self-care. She's like, and she kind of felt like this was really counterproductive. She said, a shower is not self-care. A shower is fucking bodily maintenance. Self-care is just a way that institutions have offloaded the responsibility of enacting humane work. And she talked about instead like that what she really needed was a stronger social safety net. She said, I need the child tax credit to come back. I need a financial cushion. I need time and reliable care for my children. I need consistency. I need institutions to step up and do what they're supposed to do to be humane. But they're not humane. Institutions don't take care of you. Institutions take care of themselves. And so I think Virginia's lament here kind of makes clear that we already know what the problem is, and we actually already know to some degree what the solution is, in the sense that the solution is to build the kind of stronger social safety net that would, offer real security and stability in terms of giving people not only protection from precarity in the short term, but the kind of stability that they need to pursue economic opportunities, to pursue opportunities for, success in society. And so that net would, ideally in practice, free the work of meeting people's care needs from the kinds of profit pressures that are baked into our current system through universal public systems for things like healthcare and childcare, and ideally building that system on the kinds of tax foundation that comes from primarily from wealthy people and corporations, and that is also funded to the level where this system can be both high quality for the people who need care and sustainable for the people who are doing this work, and allowing them to do this work with dignity, as opposed to kind of treating this work as something that they have to do because it's the only option available to them, regardless of how little it is compensated or paid. And at the same time, I'd argue that a key part of this social safety net is also recognizing that we all have care needs and care responsibilities, and that we can't outsource everything, that there's always going to be work that we have to do for each other, and that we all have a responsibility to participate in that shared project of care, but that there are also policies that we can put in place, things like universal paid family leave, things like universal sick leave and universal paid time off, things like stipends for families with dependents that can make it more possible for all of us to participate in that shared project, as opposed to just forcing us to push it onto whoever, and also limits on things like paid work hours that can make it easier for all of us to have the time and energy to do that work sustainably as well. So at the same time, we took steps to try to fix some of this during the pandemic. And certainly many of the families that I interviewed were deeply grateful for the support programs that were put in place during COVID, for things like rent relief, for things like the child tax credit expansion, even things like the universal free lunch program. For many families, this, in the context of rising food costs, was a tremendously beneficial program. And the student loan moratorium certainly too made it possible for families to make financial decisions that they'd never thought possible before. And at first it looked like Build Back Better might actually push us in this direction toward this stronger social safety. But instead, we ended up in a situation where where we rolled back these COVID protections, these COVID programs we put in place, and arguably a bunch of billionaires also sort of bought us out of Build Back Better and even pushed us further than that, in the sense of taking away some of the protections that we had before. And this raises questions about, certainly they do so in part by influencing politics, but we have to ask, so why are, we are still as Americans voting for politicians, not all of us, but some of us, for those who are willing to fight against a social safety net, which raises questions about, what's keeping us here? What's preventing us from fighting for the stronger net that would arguably and ideally make us all better off in the process? What I talk about in the book is that there's, key myths, kind of like that propaganda campaign that we talked about in the 1930s through the 1960s, 70s. Arguably, there are similar things going on today, even if they're not as centralized. And I talk about in the book how these kinds of campaigns tend to promote a series of myths that make it easier for us to believe that we can get by without a net, and easier to feel justified in pushing this work disproportionately onto women to do instead. And that includes myths like So one of these myths is the myth of Mars and Venus. And so this is essentially, the idea that women are happier at home, that women are better at caregiving, so they should just do this work, and that men should focus on paid work instead. And as I show in the book, buying into this myth increases the likelihood that both women, or is kind of associated with a higher likelihood for both women and men, of rejecting the need for a stronger social safety net. In one of the national surveys that I fielded, for example, with the 2,000 parents, I asked do you think it's better for kids if their moms stay home full time and don't work for pay, or is it just as good if kids have a mom who's working for pay? And about half of the dads in the survey said that it's better for kids, kind of on a binary choice. It's better for kids if their moms stay home. And those dads who said that, who chose that option, were about twice as likely to oppose things like universal childcare when posed with some policy options available to them. And so there's certainly something going on here in terms of the kinds of attitudes that people hold. And that was very much the case in the interviews that I conducted as well. I talked to one dad who I'll call Dennis. He's white, he's in his early 30s, he has a bachelor's degree, he works in tech, and he earns about $90,000 a year. Politically, he's an independent, but he likes to think of himself as fairly egalitarian. He talked about how we're talking about gender, and he's like, I don't believe in that 1950s stuff. And so at the same time, Dennis's statements about his, beliefs very rarely matched what he actually did in practice. So when his oldest daughter was born, for example, Dennis's wife, Bethany, she was working as a social worker, and she was making about $30,000 a year. And so at the time, between the two of them, they earned enough that they could have paid for full-time childcare. But because they couldn't find any in the short term and because of the costs that were attached with it, Dennis decided that it kind of encouraged Bethany to leave her job and to stay home full time instead. He talked about how it didn't make sense to spend half of her paycheck finding care. And so note the framing here, and that he's only thinking about it in terms of the money that she's bringing in, not in terms of the money that collectively they are bringing into the household. And even as the kids got older, Dennis still wasn't eager for Bethany to go back to work once they had two kids at home. Because having Bethany at home meant that he didn't have to worry about things like taking the kids to the doctor, things like staying home when they were sick, meant that he could go to the gym after work, didn't have to make dinner. She would be there to do that instead. He said, it's just easier if she takes care of all of that. That's the perk of her getting to stay home. So note again his construction there. Like the perk of her getting to stay home instead of the perk for me of her being willing to stay home. So we sort of, and that gets at this idea, this myth that he's buying into, that she's just happier here, that she's just better at this, that this is just her position. And that was the kind of thing that was echoed by many men who were in similar types of situations where their wives or their women partners were doing a disproportionate share of that labor. And so now the reality is that Bethany actually wanted to go back to full-time work. When I asked her why she hadn't, she talked about how she felt pressured to stay home, in part because both her mother and her mother-in-law had stayed home full-time when their kids were children, and how she felt like she'd be judged if she didn't. And so she kind of didn't push back when Dennis encouraged her to stay home. And so at the same time, Dennis is kind of making this assumption that she'd be happier. And he also used that as justification to say that, we actually don't need universal childcare because look, my kids are already getting great care from their mom at home. And I don't want to have to pay the extra tax money, to pay for a system that my kids wouldn't benefit from, essentially. That was his sort of justification. And that was, unfortunately, a fairly common justification among many of the dads that I talked to. So as I show in the book, these kinds of ideas about the sort of Mars-Venus myth often come from the kind of sexist messaging that kind of permeates American pop culture, from best-selling books like Men Are From Mars, Women Are From Venus, which unfortunately is having like a wild resurgence because of some TikTok videos. This is news to me, but it's super interesting. And certainly, folks like Andrew Tate, who are sort of pop culture YouTube figures who are highly controversial, but also have kind of deeply sexist messaging that they often wrap in humor. To make it more palatable. And what the research shows us on that front, what some of the experimental psychology research shows us, is that sexism and humor actually makes it more pernicious. It makes it easier for men to buy into it, to kind of accept it and laugh along with it. And also makes it harder for women to fight back because they can be very easily accused of, not taking things too seriously, or like, oh, it was just a joke. And that kind of gaslights women into kind of questioning themselves about whether they'll speak up when they're exposed to sort of sexist messaging, when it's wrapped in a joke versus when it's not. And so essentially, unfortunately, investigations have also shown that this kind of belief in, or this kind of acceptance of sexist and misogynistic humor and acceptance of and kind of attraction to folks like Andrew Tate has become more common, even among young men and boys, even those living in fairly liberal enclaves. And some suggestion, in part, possibly because it helps to promote and justify this kind of myth of Mars and Venus. It makes it easier, as we saw with Dennis, when you buy into these ideas, it makes it easier to justify accepting these perks of patriarchy. When you believe that women are just happier at home, when you believe that men are just better suited for paid work, especially when you can sort of distance yourself from the men who like hold these ideas in a really serious way, kind of like Dennis with the I don't believe that 1950s stuff, but I'm still going to tell you that like my kids are better off with my wife at home, and I'm still going to tell you that that's better than investing in childcare. So meanwhile, the myth of meritocracy operates in relatively similar ways, but thinking about divisions by race and class, as opposed to divisions just by gender. It suggests that, in the US today, success is primarily the product of hard work. And what the data show on this front is that those who buy into this idea that, if you just work hard enough, if you just have the right mentality, you'll be able to be successful, those folks are also disproportionately likely to reject, efforts to expand the social safety net. And this, again, in the interview data that I collected, I talked to one mom, for example, who I call April, She's a white evangelical Christian Republican stay-at-home mom, and her husband Mateo is Latino, and he's a pastor at their church, and he only makes about $30,000 a year. So they're not in a high-income situation, but their families actually were able to pay for them to go to public universities for college. They don't have any college debt. Their families also are relatively wealthy and highly educated themselves, and so gave them a down payment for a house. And so they're kind of doing okay despite their relatively low income. And at the same time, April still is a strong believer in this myth of meritocracy. I kind of gave them the standard kind of Pew Research Center questions about meritocracy and hard work in the surveys that I did as part of the study. Every single one, she sort of picked the meritocracy answer. And then I also presented them with a series of like policy positions. Every single one, she opposed expanding, higher minimum wage laws, so universal childcare, universal healthcare, opposed all of them. And it seems kind of ironic given that at least on paper, her family would benefit from almost all of these programs. And yet what I found when I kind of talked to her and dug a little deeper into these ideas was that she kind of bought into this idea of meritocracy because it gave her a sense of moral superiority over other families, and particularly over other mothers. During the pandemic, for example, April drew on deeply sexist and also deeply racist language to talk about sort of how she saw other mothers who were, she talked about how if other mothers needed the COVID relief checks, she took the relief checks and cashed them for her own family, but talked about how she didn't really need those relief checks. But if other families did, it must be because they were making poor financial decisions, like getting their nails done, or, having somebody else watch their kids so that they could go out partying, as opposed to, taking care of their kids at home. She said, I'd never do those things. And she talked about how she would make more frugal choices for herself, and that her family's frugality would see them through and would mean that they didn't need a stronger social safety net, didn't need the COVID relief checks, even if other families might because of their quote unquote bad choices. And April also talked about kind of similar ideas in relation to before she had kids, she worked for a religious nonprofit organization that was tasked with providing supports to families who were dealing with the child welfare system or with the legal systems. And one of her jobs was providing childcare for moms who were, dealing with various types of government agencies or various types of systems. And so those were often kids who were dealing with a high level of trauma, disproportionately low-income Black and Latino kids who are from nearby communities. And, at the same time, April could have treated these kids with empathy, could have treated their families with empathy, but instead she talked about how these kids were really poorly behaved. She called their mothers lazy for not sufficiently disciplining them to help them to learn to be kind of well-behaved. She talked about how these mothers must not believe in any discipline. And interestingly enough, what April means here by discipline is corporal punishment. She's talking about how she herself as a mother uses spanking with her own kids and believes that this is essential for raising kind of good Christian children, and sees that as superior to what she sees as sort of more lax forms of discipline that she sees as not sufficient to help raise kids who are kind of good citizens in the world and certainly good Christians as well. And I talk about in the book how those kinds of ideas link to things like the prosperity gospel and evangelical Christianity and the role that has played in kind of promoting the myth of meritocracy, and certainly how it is filtered down into things like evangelical Christian parenting books, and how these messages get promoted there as well. So essentially what we see here is that this kind of myth of meritocracy, it promotes many Americans believe these ideas. Evangelical Christianity, evangelical Christians, white evangelical Christians in the US are disproportionately likely to buy into these ideologies, in part because of these prosperity gospel ideas. And certainly, though, this also kind of plays out in secular spaces. We can think about the relationship to things like the self-help book, industry, which is a multi-billion-dollar-a-year industry, which kind of oftentimes promotes very similar ideas about if you just work hard, if you just take these 7 steps, you'll be able to get ahead. And I talk in the book about how this kind of goes back to things like the New Thought movement in the US historically, which promoted this idea that if you just kind of think positive thoughts, if you just think the right things, if you just make the right choices, you'll be able to be successful regardless of your circumstances. And one of the major proponents of this is, or has been, Norman Vincent Peale, whose book, The Power of Positive Thinking, Donald Trump cites as like his primary spiritual guide. And so you can sort of see echoes of this across many different parts of our society, both in sort of the secular and the non and the religious parts of our world. As we saw with April, kind of buying into these ideas makes it easier for people to reject the need for a stronger social safety net, because it means that they can feel a sense of moral superiority by not needing that safety net, by saying, okay, I'm well enough off to get by on my own without that support, so I can see myself as better. I can look down on those who may need that support more than I do, because most likely they haven't made the kind of good choices that would help me to get ahead. And so essentially, and the thing to keep in mind here is that really this is kind of where the engineers and profiteers of this system want us, is kind of diluted and diluted into believing that we don't actually need a stronger social safety net, and divided by race and class and gender in ways that keep us from coming together to recognize how a better social safety net could actually support us all. And so I will leave things there for today, but thank you all for being here, and certainly I look forward to questions and comments. Again, thank you. Yeah, so let me grab a pen real quick.
I just got to set up the debate with you and Brad Wilcox.
I have a whole. So chapter 4 is all about how good choices won't save women, and
I would love. I mean, he can be rational sometimes. He's a good friend.
Sure.
Marcy's too, especially, and it would really be interesting to have the two of you debate whether marriage is the answer. Because I think you'd have different perspectives. Melissa Kearney would turn her back and say something different, so don't bother with her. But Brad that would be amazing. Somebody should do that. Gradsky, I'm going to go to get Gradsky. There should be a debate. Get Brad up.
And certainly, I think I would come down on a different side than Brad Wilcox would. I think that really what the evidence shows us on that front is that, correlation is not causation, and that the kinds of factors that make it possible for women to get married and to stay married, for couples to get married and to stay married, are the same factors that promote success in our society, and that you really can't even get it. You can't buy into marriage unless you're in a relatively stable position for most people, or that it's very.
Most people don't until later now, if you get educated, and then they want to wait till that point to have children when they can provide for them.
And I think the other thing to keep in mind is not only who is in the position privilege-wise to be able to marry, but what happens to women in particular if they end up in marriage, especially in the context of high levels of precarity, in the sense that can also expose them to domestic violence, to even not necessarily physical violence, but certainly to difficult and problematic relationships. I talked to one mom, for example, who during the pandemic, so she's an elementary school teacher and her husband works at a warehouse, kind of a distribution center. She's the clear breadwinner, but her own parents she had kind of fear of losing her husband, and caught him messaging other women on Instagram during the pandemic, when she was at home teaching remotely while also watching their 2 kids. He was leaving the house to go to work every day, and was deeply frustrated by this. But when she tried to confront him, he told her oh no, you're blowing this out of proportion. I'm just talking to friends. It's nothing to worry about, despite pretty clear evidence, at least from her perspective, to the contrary. But she talked about how she didn't feel she was hesitant to leave. She didn't want to risk this, that it was that she was kind of afraid of what would happen with her community and the support that she got from people around her, and how she'd be judged for leaving her husband, even though arguably this was, not the best situation to be in.
Your book even has a story about how the golden moment in 2021, when we had emergency income payments, when we had all the things that you mentioned, and that helped people get through, and then it all went away. Yeah. It's not just about child poverty, which is what people I know right about. It's all the other sorts of supports that went away, which I think there's a good argument stream that you could make there, a piece that you might write the book as background about how it all disappeared in 22 and 23.
Yeah, there's this more mom whose story I talk about in the book. She's a low-income Black single mom who wasn't able to take any time off after she gave birth to her son because she had to go back to work right away and didn't have any access to leave. And she talked about how she was unemployed at the beginning of the pandemic, and this was the first time she'd ever just got to stay home and enjoy time with her kid. That she got to teach him how to play Connect Four and draw with him and do watch videos together, and how this was just the best time she'd ever had as a parent. And she was able to do that because of unemployment payments, because of rent relief, because of all these. It wasn't just the child tax; it was this whole suite of programs that made it possible for her to just not worry about money for a little while.
That's the sort of thing.
Yeah, absolutely.
The sort of take that I haven't seen anything else that might be really useful.
Thanks.
Power to you.
So I'm curious about the framing of this in terms of myths. because it seems like actually it's a historical fact, right? Like women haven't had a vote for 100 years. I mean, there's just a whole history of ways in which they've been systematically disenfranchised, marginalized, economically exploited. And so to talk about it as sort of this myth that is in just the presentation, I haven't read the book, this myth that's in the ether rather than a continuing perpetuation of a system that is consistently, oppressed and harmed half the population seems to me to be a little more palatable to those that don't agree with you, perhaps, but
for sure
disingenuous to really what the history is for women in this country. And
yeah, absolutely. And I have some related article publications that kind of try to tease this apart a little bit and kind of finding the structure and the culture that's in here simultaneously. And I think that they are, I think what I try to talk about with the myths is sort of the cultural wrappings that we put around the structures to make the structures more palatable, in the sense that, during the pandemic, one of the sets of questions that we tried to unpack was sort of how did women become the default parent? How did couples arrive and justify this?
But it's not a new situation.
Yeah.
I mean, I guess that's what I'm saying.
That's true.
Sort of talking about it as if this is a surprising and new thing, whereas historically
it's deeply rooted in.
It has always been the case, and that there has always been a class that has benefited from that and has sought to hold on to their power despite many deeply moving efforts to stop it. So that's where I feel like it's like, this is not a surprise.
Oh, no.
Yes, no. And in fact, we are better off than we were 100 years ago when we couldn't vote. But in lots of ways, so I don't know. To me, it just feels really disconnected from feminism, for example.
Sure. Yeah, and I think what I'm trying to get at there is this idea that we can see the structures, but we have that at least these cultural ideas help some people to accept them.
Right, which is different than these myths exist.
Yes, that's a good point. Yeah, exactly. That it's about who buys into them and why. Right. Yeah. Because certainly, yes, this is not new, and it's reinforcing in ways that the couples that we talk to, certainly who was already the default parent before the pandemic, but then even on top of that, it had to do with sort of whose income was sacrificable, which had to do with gender pay gaps, which had to do with all the who was doing the work that was more.
And you talk a lot about their parents influencing them, right? Mm-hmm. And that's the same generations ago that were living under different rules.
Yeah.
I have a question about the sort of the overarching framework that you presented, just from not a sociologist point of view. So if I'm a profiteer, wouldn't I want universal child care as an activation function to drive more people into the labor force so I could then have more competition and pay my workers even less?
I would argue that not necessarily. If there are some jobs like child, and I talk about this in the book, of the kinds of jobs that are disproportionately onto women are jobs that are too labor intensive to be profitable, but that still someone needs, that we can't outsource them, and they're too labor intensive to be profitable. So things like childcare are really not sustainable. You can't make a profit off of childcare without either exploiting workers or government subsidies. And so it's I think there are certain jobs in our economy that work. There are actually many, many jobs in our economy that are kind of at the margins like that. Even things like, grocery sales are the margins there are so slim that grocery workers are often deeply low paid because this is just not a viable industry without that kind of exploitation. And so I think what this kind of system does is ensure that there is a viable workforce who can be kind of toggled in and out of the labor market, depending on the needs of the economy. And that's essentially what we saw, I talk about in the book, kind of after World War II, and kind of pushing women back home to make room for men in the economy. That's very much what we saw during COVID too. We kind of pushed women out of the economy in this moment where we didn't need that many people in the workforce. And then we wanted them to come back when we needed them. And so it's sort of this toggle switch of kind of how much labor do we need and who can be put into a situation where they're forced to take whatever job is available to them because they don't have any other options, because they don't have full-time childcare, because they don't have, paid leave, because they don't have these kinds of protections. So that's the best option they can get. So it's about filling these kinds of often deeply underpaid, highly feminized jobs, but they're deeply underpaid and they're feminized because of the sort of structures of work that are behind them. So that's sort of,
it's about the precarity.
Yes.
This was a great talk. Thank you for this. I was just curious though, in some of the examples that you gave, like this, there was this, not like a hypocrisy, but like a disconnect in the way people would talk and the way that people would act. And I was curious, like in any of the interviews, did anybody realize this or make a connection? Because it doesn't seem like there's that acknowledgement of that hypocrisy there. So I just find that interesting.
Yeah. And I think that's to Catherine's point, I think that's where I talk, like, that's where this idea that it's being a myth comes from to me, in the sense that like there's a self-delusion involved.
Yeah.
Not be able to see the disconnect between the choices that you are making, the inequalities that they're contributing to, and the way that you're justified. Yeah.
But doesn't it suggest that there is some identity that does benefit from it, right? So it's like we're saying like they would all be better off, but in some ways they would not, because their masculinity would not give them the power that it does.
Yeah, so I'll be better. That's a good point.
So like you don't, so that's why it's like it's a myth, it's delusional. It's not actually delusional. It provides them with a level of power and economic primacy that does benefit them in some ways.
Yep.
And so that's why I just
yeah. And I think it's about in an absolute sense, we would probably be better off, in the sense that like
they would disagree. I mean, I think so I think that's the fight, right? Like, because then masculinity isn't the power structure.
And so yeah, and so it's
then no, they aren't better off.
At least in yes. especially in that relative sense, and especially in terms of power sense. In terms of, I think you could make an argument that they would absolute dollar wise, like if both Bethany, if like social work was higher value, and
but I think in point it speaks to the fact that higher dollar value isn't driving behavior.
Yes.
I feel like they have like some power.
Actually, they don't feel like they have actual power. Let's be clear.
Yeah.
Not
definitely. Thank you.
Comment. So comment, the story that you're telling now is a story where women are victims and men are triumphing. And I don't know that seems true. I think you can have a system that gives more power, but also takes things away. So there's a price men pay for getting shoved out of parenting. And there's a price men pay for being treated as a paycheck and not as a person with emotions and relational connections that are meaningful. And so taking those consequences of the system that you're talking about, I think, more seriously, so that it's not like men are just winning this, thinking about the costs. And then the other thing that I was thinking about, and I don't know enough to sort of ask the right question, so I'll just sort of put the topic out here. I was thinking of, Western Europe, and that, many of the social democratic and conservative welfare states that are more developed than, or more generous, more decommodifying than the neoliberal welfare state of the US. And yet we see a lot of gender inequities. And in some cases, start with women being able to go to work in Germany and working full time. Kids were going home for lunch not that long ago, right? So how do we square some of the realities that we see in other welfare states with the story that you're telling?
So to the first point, just write that down the floor. Yeah, so to the first point, this idea, and I think you're right, that there is something to be lost here, and that there's, I talk in the book about sort of the problems with our ideal worker norms and how these are putting pressure on men in ways that discourage them from investing in care work. And this gets back to the point I was making about sort of a stronger social safety net would not only help us to outsource this work, but make it more possible for all of us to participate in this work in ways that allow care work to be valued and seen as a worthwhile pursuit for all of us to invest in, as opposed to just women. So I think you're right that there is something to this idea that men are losing out by being denied those opportunities to care, even if in terms of power and in terms of kind of financial stability, given the way that we currently value or devalue care in our economy, that's the position that they're in on that front. And certainly there were dads that we talked to, at least a few, who very much wanted to be home more, but felt like they couldn't because of the kinds of, oftentimes precarious financial situations that they were up against, and felt frustrated by kind of the lack of options that they had to be able to be at home in those kinds of cases. And there were a handful of stay-at-home dads that we talked to too, who often, their situation was often interesting in that the moms often felt a high level of guilt to do more at home because they felt bad about having their partners be at home. But certainly those dads felt a lot of sort of shame in some cases, or sort of social pressure around not being the primary caregivers. So I think you're right that there is something lost when we support men in doing the kind of care work that often falls to women, and in terms of their identities and relationships, in terms of the sense of satisfaction that can come from doing meaningful work in those processes too.
Swedes were able to increase paternity care from like 30 to 60% through various policies, but I'm not sure I know a number of other countries where paternity leave is anywhere near that level.
And they had to basically force it to use it or lose it, because when they just offered it, men didn't take it.
And I think that gets to your second point here about, I mean, really the best way to get people to buy into these policies is to put the policies in place and to make them as strong and get everybody to, so it's sort of this like self-reinforcing cycle, in the sense that in the absence of these policies, and especially when they're not used fully, that it becomes harder for people to buy in. But I think you're right that things are not, certainly not perfect elsewhere. And I think that's in part because one of the pieces that I would argue is that the social safety nets that are in place elsewhere often do focus on, at least especially in some of those countries where, like places like Germany, are focused on providing support with outsourcing some forms of care, but don't necessarily make it more possible for everyone to participate equally in the shared project of care in ways that kind of encourage that collective participation. And kind of to the point about, paternity leave and whether that's kind of encouraged versus discouraged, and that it really takes kind of both parts of the equation to address those kinds of gender inequalities. There's a great book by sociologist Katie Collins called Making Motherhood Work, where she's comparing relatively highly educated white, or maybe they're not all white women, but it's mostly white women across 4 different countries with different social safety net structures. And essentially finding that of all of those, women in the US, not only do, even compared, I think, I can't remember what the 4 cases are in her study, but even compared to some places like that, women in the US are doing more. And also one of the things that she finds that's sort of the most damning is that they have more guilt about it too, in the sense that they sort of internalize the pressure that they're supposed to be able to do it all without support. And that's a piece of it too, in the sense of like the sort of moral and emotional side of the pressure that comes from the sort of DIY model, where it's you're not even supposed to think about relying on anyone else for support in raising your kids, in a way that at least collectivistic structures might be more in place elsewhere to make possible that labor. But yeah, I mean, I think it's a complicated story, and there's lots of factors that.
Just wanted to ask, I think one of the strongest pieces of this work is how you tease out the heterogeneity between the different cases that you highlight here. It just really builds the case that you. I did want to hear a little bit more about the dads who were the primary caregiver, and how that either complements or changes the narrative that has been the argument and the narrative that's constructed relative to what you tease out amongst the women and the heterogeneity you see there.
Yeah. So the interesting thing, so there were the stay-at-home dads that we had were not a uniform bunch to the point of heterogeneity. That there were a handful that were. There was one couple where she. So she's white. Has a master's degree in social work. She works as a kind of therapist, essentially, or was before the pandemic. She was working in kind of social service agency as a kind of trained mental health therapist. Where her husband is a South African immigrant who came to the U.S. to get a college degree, but has sort of struggled to finish his education, in part because they've had to move around a bit for her job and to get married. And so he's kind of in a relatively precarious situation and has struggled to find decently paid employment. And so before the pandemic, when we first met them, she was working full-time. He was still enrolled in kind of part-time college classes and was working part-time as like a leasing agent, making basically minimum wage. And then once they had kids, he essentially became, so they had her mother was their primary child care, and her mother actually passed away right at the beginning of the pandemic. And so at that point, he became the primary child care provider, but actually didn't tell anyone he didn't tell his extended family that he was telling his family back home that he was working full time, but he was getting pressure from them to send money back home, and they felt guilty because they couldn't afford it. Her income working for essentially a child welfare agency was not. I think she was making like $50,000, $50,000 a year, even with a master's degree. And so it was not, and he was making maybe $10,000 a year with a part-time job plus student loans and all those things. So it was a tricky situation for them. And this was a constant source of stress for them, in that like she felt guilty that she wasn't able to give him the breadwinner role that he felt like he was getting pressure from his family to be able to play. And so that was a really challenging situation for the two of them, and ended up actually leading to some bad financial decisions, in the sense that he really wanted to, when the kind of when the pandemic housing market kind of ramped up, he thought, okay, maybe I will go get my real estate license and become a realtor and see if I can make some money that way. But he didn't have an established client base. And he was paying for an office space, essentially, so that he could see clients somewhere and make it look kind of professional. And they were losing money kind of hand over fist trying to pay for this office space, that he had stopped kind of bringing in, he'd stopped doing his leasing agent job, and he's now trying to make it work as a real estate agent. But she feels like she has to support him in trying to do this, even while he's actually still the primary child. She's like cutting back her work hours or like working. And so it was just kind of this, emotionally messy and complicated situation. There was another case of a dad who was a stay-at-home dad, who his wife was a physician, a fairly highly paid physician, so he was working as an art appraiser before they had kids. And so once they had kids, it was sort of like his income was so far lower than hers. They're both, college educated. I think they actually both have at least, she's a doctor and I think he has a master's degree. But it made sense, for him to stay home, and he actually embraced it and was like totally on board with this, in terms of being the full-time caregiver. So she was the one who was sort of like felt guilty and so she would always try to kind of check in with him and make sure he was getting enough time off, and make sure that like she would work from home whatever days that she could, and kind of, so I think there was sort of a guilt on her end in that case of feeling like she was putting too much on him, in a way that was very rarely echoed from the stay-at-home, from the husbands with stay-at-home wives. That was sort of, it very rarely worked in the other direction, in terms of like feeling a high level of concern about your partner's well-being in those kinds of situations. And so they were certainly not unhappy with their situation, but it did cause some tension in that sense. I think it's, and I talk about it in the book, is like just kind of getting dads to step in as the stay-at-home parent isn't necessarily better, because it can work for some families in some contexts, but really we just need to make it easier for families to have the resources to make the decisions that work for their families and their context, and as opposed to kind of just push it all into men, or just tell men to do more, especially given the risks that can come with that, given the cultural pressure and the sort of ideal worker norm pressure that they're facing.
In the talk, we emphasize a lot on childcare and the need for universal childcare, but I think of the safety net as broader. So I'm interested in like what you think of the safety net needs, or is it all childcare that we need? Or you mentioned taking up a little bit, but I'm just kind of curious more broadly about the safety net.
Yeah, absolutely. And so certainly, I think the interest of brevity, focusing mostly on childcare here, but there's similar stories echoing in other parts of the safety net in terms of healthcare, in terms of elder care. I have a couple of moms in the book that worked as home health aides, and the kind of precarity and getting pushed into. There's one mom that I talk about who actually wasn't a mom. Biologically a mom herself when she became a mother to her brother's children, when she was only essentially, so her older brother and his partner were both heavily addicted to opioids, and Child Welfare Services took the kids away and placed them with her brother's mother, and thereby with her, and her mom was already working 2 jobs as a home health aide. And so she, as an 18-year-old, became the primary caregiver for these 2 young kids, and ended up taking a job as a home health aide herself to help support the family with these 2 young kids at home, and the kinds of challenges. And so it's the similar types of precarity that can push people into all of these different types of underpaid care industries, and certainly can play out in terms of and I think even I think childcare makes this particularly stark, given how the constant needs of young children make it almost impossible to do anything else while caring for them, in a way that maybe elder care doesn't always work out quite that same way, but similar types of stories too, in terms of the way that high demand elder care responsibilities, high demand responsibilities for sick or disabled partners, or there was one family, the mom has experienced pretty severe long COVID symptoms, and dad ended up becoming the primary care provider, both for her and for the family. She was a full-time RN who got COVID very early on and ended up having a series of strokes after getting it, and has dealt with a lot of lasting complications from that. So he kind of stepped in and had to play a caregiver role for her, a caregiver role for the kids, kind of dealing with extended family stuff. And so I think there's certainly ways that this echoes and ripples out across other parts of our social safety net in terms of care needs, and then certainly in terms of things like our welfare programs, and then the sort of insufficiency, as we saw with families like Akari, the sort of punitiveness of these programs and how they force families to take. Often it's kind of pushed into these kinds of underpaid industries where they have so little choice about what to do, given the insufficiency of our safety net on those fronts as well.